Hello, good afternoon, good morning, wherever you are across Canada. Welcome back, Symposium viewers. My name is Sabrina, and it is an honor to be your host this afternoon on Stream B. We hope you enjoyed those videos that we shared during the break. And just a reminder, those videos can be found on DWP's YouTube channel. At this time, I have the pleasure to now welcome the next panel, and the discussion is on the 2SLGBTQ plus people with disabilities and experiences of poverty in Canada. This panel is being moderated by Nick Mule. Hi, Nick. I understand the panelists today, including yourself, are all from different parts of Canada. I'm wondering if the panelists can introduce themselves and let us know where they're at in Canada. Thank you. And over to you.
Thank you so much. I just was just now able to unmute myself. Thank you for that. My name is Nick Mulé. I am a faculty member at York University, and I am the project director of the study that we're going to be presenting on shortly. Thank you, Sabrina, for that. I do see a couple of my panelists present. I'm just going to call upon them to do a quick and brief introduction as we were asked to do. I'll start with Luca.
Hello, everyone. My name's Luca Gheorghica. My pronouns are they, them. I'm from Treaty 1 Territory, Winnipeg, Manitoba. It's a pleasure.
Thanks, Luca. Appreciate that. Dani?
Hi, everyone. Thank you, Nick. Is this volume good?
Sounds good to me.
I'm Dani from Niagara. Pronouns are they, them.
Thank you, Dani. And do we have Mike present? I'm not sure if... there he is.
Hi. Sorry, I was having trouble unmuting myself. Uh, I'm Mike Martell, he, him. I'm actually not in Canada. I'm joining in from New York State, and I'm delighted to be here.
Great. Thank you, Mike. And I will just mention very quickly that one of our co-presenters, Celeste Pang, unfortunately could not join us today. She woke up ill today and unfortunately is not able to participate. So we are wishing her well. So as a quick introduction, the title of our presentation is 2S LGBTQ plus people with disabilities and experiences of poverty in Canada. This is coming to you from the study 2S LGBTQ plus poverty in Canada, improving livelihood and social well-being. I should have pointed out when I said I was at York University, that's in Toronto, Canada, just to make that point. Just to provide you with an overview of what we're going to cover today, we'll begin with a bit of a backgrounder with regard to the project. Then we're going to allow one of our community advisory board members to take a bit of a turn from data and research findings presentation to speak to their personal experience as someone who is a member of the 2S LGBTQ plus communities, as well as living with a disability and others that they know that are having either similar or different experiences. We will then go into some of the data information regarding the study, and we'll begin with a prevalence of 2S LGBTQ plus participants with a disability. Then we'll look at housing issues, food insecurity, employment challenges and social assistance, community services and supports. Then, in reflection on those various themes, we're going to have another of our community advisory board members, also a member of the 2SLGBTQ plus communities and living with a disability, to reflect on the themes that and our findings that we're uncovering in this preliminary stage of our study, as well as their own personal experiences and those of others that they know. We'll then open it up to questions and discussion, and then we'll conclude with contact information if anyone's interested in maintaining contact with our project. So I'm just going to provide you with a little bit of a backgrounder on the project, and that is to say that we are the first national study examining the prevalence and effects of poverty on 2S LGBTQ plus populations in Canada. This study, we were really fortunate because we got one of the bigger envelopes from the Social Sciences and Humanities Research Council, known as SSHRC, through their partnership grant envelope, in which we were awarded $2.5 million. We designed our study to run for 6 years. We get an automatic 7th year from the funder if we need it, and we know we need it already. And so we were funded in the spring of 2022. We are scheduled to complete in 2028, but we'll more than likely use the extended year, which will take us to 2029. We have an estimated project membership of roughly 94 people. I say estimated because this does fluctuate and it can change literally by day. But we are a large project with a large team made up of academics, students, postdoctoral fellows, community advisory board members, community partners, peer researchers, a whole array of individuals that are contributing to the work of uncovering this material for the first time in Canada. We are also methodologically, we operate via a community-based research study approach, which means that we work in collaboration with community members in carrying out the work that we do. The goal of our research is to create evidence-based knowledge on how and why poverty affects 2S LGBTQ plus communities in Canada, to inform policy and community-based action to address existing inequities. This presentation is based on preliminary data gathered from our national survey, and this is something that we're just dipping into in terms of analysis. So you're getting the very early findings that we're able to uncover, but you're also quite privileged because this is the first time we're actually sharing these findings from our survey. So at this point, I'm going to turn it over to Dani, who is a member of our community advisory board and a person from the 2S LGBTQ plus communities with personal experiences of disability. Go ahead, Dani.
Okay, thank you. I had this prepared before we introduced ourselves. Sorry to repeat things. My name is Dani Hummel. My pronouns are they, them. I'm a white fat-bodied person with a red blondish beard, and have auburn hair that's up in a bun. I'm wearing a black and white kufiya and black framed glasses that have a reddish-orange tint. I have a hope nose ring and a vertical labrae piercing. I communicate in a few ways, with a preference for ASL, but I'm not yet fluent. I'll use text-to-speech and verbal communication for today. I'm a member of the Community Advisory Committee for this project, and I'd like to take a moment to just orient myself in relation to this project, where I'm located, and my experience with poverty and disability. So I'm a multiply disabled, queer, transgender artist currently living on the lands of the Anishinaabe, Haudenosaunee, Wendat, and Chinantan nations in Niagara. I live in the city colonially known as St. Catharines, and the city council here is actively attacking our residents most impacted by poverty, particularly the unhoused. Here in Niagara, Indigenous people make up more than 50% of the unhoused population as a direct result of the ongoing genocidal colonial project that is the Canadian nation. Many of our unhoused residents identify as two-spirited and or within the LGBTQIA+ umbrella, especially among our younger residents. After Indigenous people, people with disabilities are the second highest population within our unhoused community here in Niagara. So while I'm here today to share my experience with poverty as a queer disabled person, I would like to emphasize that I can only ever speak from my own experience, and while I can share what my personal community has entrusted me to share, there are experiences that I don't have and I can't speak to. I myself come to poverty and precarious housing from childhood. I grew up in induced poverty as a result of domestic abuse and have lived in poverty my entire adult life. As a disabled adult, I'm not able to consistently work due to the dynamic nature of my disabilities, and I'm financially reliant on Ontario's Disability Support Program, ODSP. My experience with disability is complicated, as it is for many people, and despite coming from a disabled family, disability was not something that my family accepted or identified with. Due to the religious and isolated nature of how I grew up, the symptoms my siblings and I showed were perceived as demonic, and so disability was not something I understood as a child, and it definitely wasn't something I identified with. When I did enter into the medical realm of disability, it was through mental health. So my childhood was not punctuated by the medical industry the way that is more common with people who have similar diagnoses, but there was never a time where I didn't know that I wasn't like my peers. Entering into the disability community as an adult in my 30s was one of the most beautiful experiences I've ever had. As complex and nuanced these experiences are, it gave me language to communicate.
Does that conclude what you wanted to share, Dani?
Just going to slow down a little bit on this text to speech.
So was there more, Dani, that you wanted to share, or there is? Okay.
Despite living in Niagara since 2007, I have been deeply isolated due to the intersecting identities of being queer, disabled, and living in poverty. That didn't change until I was connected to the Willow Arts community, a small community arts organization that provides completely free and low-barrier arts programming and education to those living with mental illness and/or substance use disorder. It was founded by and continues to be run by those who carry this lived experience. When all the other disability organizations in this area shut down during the lockdown, the folks at the Willow moved their programming online and continued to safely deliver art supplies to members, still for free, because they understood the danger of isolation for our community. And long story short, I joined this project because organizations like Willow depend on funding to continue operating. That funding is under constant attack. We rely on the researchers to prove to our governments and communities that our lives are valid and worth living. That's such a huge responsibility, and it's so important that those of us who are most impacted by cuts to these programs, these literal lifelines, have a say in how that research is done. And that's all I'm going to say for now. I have lots of thoughts and examples for the topics we're discussing today, but I'll save that for the discussion part. Thank you.
Great. Thank you so much, Dani. I also just want to, before we move on, I want to just share with the audience that the image you're seeing on this PowerPoint slide is a creation that Dani produced based on his experience. So just wanted to credit you for that, for this great work. And we will now move on to the next set of slides. The next 5 slides are based on data, preliminary data that we have collected thus far in our study. And so I will turn it over to Michael Martell, who is a member of our quantitative research team, who was very active and involved in the design and implementation of our national survey.
All right, thank you. Before I get started, I'm just going to note that right outside my window, there is quite a bit of construction happening. And so I apologize if there's a dull roar that makes it even more difficult to understand me because sometimes I don't speak all that clearly. Um, and so I'll spend a few minutes talking a little bit about some of the preliminary results from our survey. And I can start by thinking about prevalence. And so we asked all those who responded to our survey the question, do you identify as a person with a disability? And just over 43% of the folks who shared with us responded in the affirmative. Uh, and then when we followed up on that question, asking which, if any of the following conditions or realities do you currently live with, um, uh, over 95% of the people who identified as having a disability reported one or more conditions that affect their day-to-day functioning or reality, and the most common condition reported was chronic illness. But then also it's important to note that a number of the people who did not identify as having a disability also reported that they had a condition or reality that affected their day-to-day functioning. And so about 40% of those folks did, and the most common condition that they reported was having a mental health condition. Good. We also asked the individuals who responded to our survey about their housing issues. And we noted that when we asked individuals, have you ever been homeless? That is, having to live in a shelter on the street or in parks, in a makeshift shelter or in a vehicle or an abandoned building. About almost 1 in 3 individuals who identified as having a disability had experienced a state of homelessness, which is quite a bit higher than about 1 in 5 individuals who did not identify as having a disability. When we followed up with a few questions asking about the duration of a homelessness experienced or the type of dwellings individuals lived in, we did not, as of yet, see any substantial differences across those who identified as having a disability or not. We also asked individuals about their access to food. And we asked, did you and or other adults in your household ever cut the size of your meals or skip meals because there wasn't enough money for food? Those who told us they did not have a disability, about 50% or half had cut the size of their meals. This was more common amongst our respondents who indicated that they identified with a disability, of whom about 60% had. When we asked individuals, did you and or other adults in your household ever not eat food for a whole day because there wasn't enough money for food? Individuals who indicated they did have a disability and did not disability had similar overall responses. About 70% responded in the affirmative. But maybe one thing that is worth noting in this case is that a lack of a difference in the response about not eating for a whole day doesn't mean important difference in access to food, and food security don't exist along other margins, such as being able to have food that matches your dietary requirements. We also ask questions to better understand employment challenges and social assistance our survey respondents faced. And one thing that we note is that employment and income assistance programs are tied to not engaging in paid employment. And when we asked individuals who told us they identified with a disability and individuals who told us they did identify with disability, we saw some possibly important differences. About 5% of our individuals who did not identify as having disability are not employed and not looking for employment. But on the other hand, the individuals who told us they did identify as having disability, twice as many or 10% of those individuals were similarly not employed, but they were also not looking for employment, right? This could be related to EIA. We also noted that those who identify with a disability are more likely to be on disability assistance. About 25% of these respondents reported being on assistance, compared to only 1% of individuals without a disability. And the type of employment secured by individuals who identified with having a disability were more likely to be, they were more likely to describe it as either casual or gig work, which could be more precarious. And then I'll end with community services and social supports. We also asked, have you ever accessed emergency or community food programs such as food banks, food hamper services, and or free meal programs? Those who identified with a disability were more likely to have accessed these programs, 60% compared to 43%. Suggesting that these programs might be important. And then we also asked, how would you describe your sense of belonging to your local community? Those who identified with having a disability, about 70% of them indicated that, that their sense of belonging was very or somewhat weak, which was somewhat higher than those who did not identify as having a disability. And with that, I will pass it along to our next speaker. Thank you.
Thanks, Mike. Really appreciate that. And so we've just shared with you a number of preliminary numbers and the first across Canada regarding these communities and disability. But bringing us back to personal experiences, the actual stories and what it's like to live like this oneself, as well as in circles where others are also faced with these challenges. I bring you next our another member of our community advisory board, and that is Luca.
Hello, everyone. I hope you can all see me and hear me. My name is Luca Gheorghica. My pronouns are they, them, theirs. I'm going to share from the heart. As I'm reflecting and hearing the voices echoed through the community today, it brings many reflections upon myself and makes me really reflect on our housing, our food, employment challenges, social assistance, EIA, disability, commonly known in Manitoba, community services and supports in that community care. I am a person with lived experience. I have a hidden disability, which is about to be exposed. So I'm legally blind and vision impaired. So I have no vision on my right side and little to no vision on my left side. So I can't see computer screens. Accessibility is a huge challenge for me, even entering panels or doing the community work I've continuously done for the last 15 years as an international advocate fighting for queer rights with living with disabilities or lived experiences and bringing those lived experience voices to the table, and ensuring that we have lived experience voices coming forward and being at each table discussion when it involves us, not with us without us kind of approach in our advocacy lens. I am community based, community focused, and community driven. I was born in Bucharest, Romania. I am a survivor of genocide. Um, my housing insecurity, I will say, I'm still facing 38 years later. I've lived in many different forms of housing units, right from orphanages to CFS to group homes to the hospital. And I finally got out of the system in 2019, where I actually finally got to start to live. When you're living on low income or below the poverty line here in Manitoba. You only get $3.96 for money a day for food. When transportation is now $3.35, to put in a perspective. Employment challenges are next to impossible if you're legally blind. You can't, like, I can't apply for just any job that I would want to, even though I have the skill set to do so. I actually got removed from a job when I was doing cashiering because I ran into too many walls. My apologies. So I've been on income employment assistance, EIA disability, since I was 18, and I was granted a disability as soon as I arrived to Canada, and was told I would face these challenges moving forward. For the community services and connections, I've been doing advocacy for the last 15 years, and the last 10 years, in particularly out of the University of Manitoba, with poverty awareness and community action, sharing my lived experience with other healthcare providers so we can ensure a safer approach to that community care that we are all deserving of, and gender affirming care as a trans person. I've had the pleasure and opportunity of doing that for the last 10 years. It is my passion work. It is my soul work. I was recommended through the poverty reduction strategy here in Winnipeg out to York University for the 2S LGBT poverty and social well-being. And that's how I made my connections. I'm on multiple different projects and have multiple different perspectives and lived experience as someone who's been all over the place. Unfortunately, when you have so much lived experience that people start saying, here, come speak for us. At Bill 208 for gender affirming expression under the Charter of Human Rights, I said at the human rights, or I said at the legislation building, sometimes there's such thing as too much lived experience. I am tired. I am an advocate at heart, but it gets hard because when you're living with a disability on top of facing many challenges, not just those housing precarities or food challenges or employment, but I mean, we're losing a community in front of us. I just attended a 4-day sacred fire doing overnight shifts for a community member we just lost to lose a family member during that sacred fire. So we are losing a community in front of us. And like, with government taking away many programs that are saving the lives of community members and backtracking into old times, like, it's kind of scary as a queer person or a person living with a disability. And when you're living with both, it's terrifying. And hearing some of the other speakers this morning, knowing that MAID is an option, that is definitely something I've played around with in my head as an advocate. I'm one hell of an advocate for other people, but I'm at risk of being homeless any day now. I'm on the emergency housing list with Sunshine House here in Winnipeg as I speak. I advocate for the rights of other people while my rights and dignities get stripped away from me. I put my life in front of others. I can barely even access conferences sometimes because of your security profiling. I'm a person who has multiple tattoos. I don't notice them half the time because I'm legally blind, but other people sure do. And I don't always understand why people mistreat me, but it is profiling and I receive a lot of it. And even within the project, I get a lot of support from our fellow peers, but mainstream businesses and entering conferences is next to impossible if you have lived experience. If we want lived experience voices echoed through our communities, which is valid and true, we need to allow those people in our hearts and our doors and not close them out. We have a very scary bill trying to be passed in Winnipeg, the 72-hour hold. As someone who has experienced the medical system through HSC and the psychiatric unit as a child and adolescent, I have been in those holding cells. I have been in isolation as a determinant of trying to change radical behavior of what was socially unacceptable during those times in the 90s. I have nightmares to this day because of that. Those isolation cells, seclusion rooms, as they called it. They're more trauma informed now and call it quiet rooms. Let me tell you, there is nothing quiet about those rooms. It causes trauma and it damages our community and our loved ones and our relatives and people we care about. This is why I speak out about this. Um, I share this experience on my half, but on behalf of our community members and our relatives, because nobody should have to face this alone. I run a advocacy group with the university. As I said, I'm on multiple different kind of projects, and they finally connect the advocacy group I'm working with right now. They finally connected me with CNIB, Canadian Blind for the Institute here in Manitoba. It has been such a pleasurable journey. 2 days later, I got an initial intake. I'm now being set up where I'll have auditorio things on my phone where I can hear the commands opposed to trying to navigate. I can't do screens. But I'll be able to have little pick me ups along the way so I can continue doing the heart work and advocacy work I am so passionate of doing. I mean, because of my vision impairment, when I was helping a queer newcomer come from Nigeria, which I didn't know they were in Nigeria at the time when they emailed me because of my vision impairment, I managed to get them here on my own. I actually thought they were already in Winnipeg, but they weren't. And so I arranged and got this person to Canada where they could seek refuge and be safe here. So that's just kind of some of the passion work I do in community. And because of the project I'm with in Toronto, I'm able to continue that work. Even with a disability, I'm still able to do this. We have learned new approaches of navigating. I mean, I let Nick and Shanaz know immediately, like, you might get some obscured emails, but I'm trying. And they gave me the confidence enough where I'm now helping co-chair as a cab member for the team. And that is a position I never thought I would be able to get into because of my vision impairment, but because of the support and community care and moving forward, I'm able to be in that position. And yeah, like, poverty is not going to go away, but we can reduce the barriers to make it easier for the livelihood of our relatives and community members. That is a little bit of the reflections from me. Thank you for letting me speak from my heart, my experiences, and on behalf of our loved ones.
Thank you so much, Luca, for presenting in such a heartfelt way your personal story. That's very much appreciated. Similar to the slide that we had earlier with regard to Dani's creative work, I also want to credit Luca for the two images you see on the current slide of artwork that Luca has created as part of their, I would say, passion work as well. And I'm grateful that you ended your comments with such a tone of resiliency.
Nick, I wanted to share the pigeons of the harm reduction pigeons. So in on Treaty One, when there was a harm reduction walk happening, someone snapped a photo of a pigeon with a syringe in its mouth. And I was absolutely like, even the pigeons know best. Harm reduction is the way. And I started beating these medallion pigeons from the heart. And I don't sell the pigeons, I only gift them away to community members that have lost loved ones to substance use or a community organization. So the ginormous pigeon you see was raffled off for Sunshine House when MOPS was at risk of being pulled because our government doesn't feel that harm reduction and reducing overdoses is crucial in our province. And I was not having that. So I raffled that pigeon off, and the community was able to donate enough money to give to Sunshine House. So that's giving back to the community. So thank you for letting me share about the beaded pieces.
Thank you, and thanks for this very creative work. It's wonderful. Okay, we have about 15 minutes left, if I'm not wrong, that I would like to open up for any questions or discussions with those that are attending here. And you can direct your questions to any of us that have presented or in general. And we're very open to just having an open discussion here.
Thank you so much. I just wanted to say to the panelists, thank you very much. It was an excellent conversation, shared of stories of shared experience, just really touching. And also just we appreciate that you've shared this in this space. So thank you so much on behalf of Disability Without Poverty. I have two questions for you from the chats that have come in, and I hope you'll enlighten us. And it's not directed to anybody, so whoever would like to take the question or would like to jump in would be wonderful. The first question is, what role can community organizations and allies play in fostering belonging and reducing poverty among 2SLGBTQ plus people with disabilities? That's the question. What role can community organizations and allies play in fostering belonging and reducing poverty among the 2SLGBTQ plus peoples with disabilities? Yes.
I have unmuted and I'm going to just start speaking.
Thank
So I
you.
think that's a very lovely question. And I honestly asking people's pronouns, respecting people's names, meeting people in life where they are at any given time. This includes like gender affirming care for elderly patients. So I've been really working alongside because the queer community's been doing it right the whole time. Like we're able to interact with any age group and it doesn't matter. So like our housing situation, we can house queers with multiple different ages and be okay, where you don't find that in other communities as much. But I think, yeah, just meeting people in life where they are at and asking and practicing even on an inanimate object. I'm learning pronouns every single day. As a queer person, as a trans person, I am learning there are so many pronouns out there and it's beautiful. It's a language. So learning queer lingual, taking in queer culture and embracing in these kind of conversations, that's the first step. And then really honoring that by continuing that pattern. So that's a little bit of me. I'll let the other panelists speak.
Are there others, Dani or Mike, that would like to share?
I'm trying to think of answers. I will let Mike or Nick go while I think.
Sorry, Mike.
No, you didn't. Okay. Luca, did you want to add something?
Yeah, I could share from a healthcare provider perspective, through my journey with the healthcare sector. Um, when I was in hospital last year, I had legally changed my name, yet it wasn't updated on my health card. So what the nurses did was crossed out my name and put on Luca, so I wouldn't have to see that for that part of gender affirming care. So that is like one small example what healthcare providers and service providers can do. Um, Even like I actually asked the emergency room, like, does it actually show you my preferred pronouns? And they're like, no. And I was like, okay, cool. So I have to remind you every time. Thank you for being honest, because now I can at least let other trans folks know, like, they actually don't know. So that's a thing, is like you can use someone's dead name in a private, confidential setting where that person, for example, if it's me, Luca, where Luca doesn't hear that name, Luca is not part of that conversation of the old name that was attached. So that is one thing healthcare providers can really do, is hide that part and work with what you have in front of you, that person in human being. Yeah.
Hmm. Thank you. Danny?
Thank you, Luca, for sparking idea answers. The healthcare, and like incorporating the accessibility and keeping in mind that like as an individual, we're not like my queer identity is not separate from my crip identity. It's not separate from any other part of me. And so, like an example, with my own healthcare person, doctor, they um, have accessibility notes that they've been told about repeatedly, um, but every time they still don't do it. Like just providing a written document of like what we talked about, because they don't retain auditory information very well, and she doesn't do it. With gender affirming care, she has wanted me to like go out to other doctors and stuff because she's not comfortable filling out the forms, because she doesn't understand how to do it and wants me to come back and show her how to do it, which has resulted in me not getting access to a gynecologist, which I've never had access to due to medical trauma and all kinds of things. And I probably should have seen one before even starting hormone replacement therapy, but I didn't. And so, and this gynecologist has said that they won't see me until the paperwork is filled out, but I can't get the paperwork because the doctor won't fill it out, and she wants me to go find this other doctor and like do all this. There's so many steps that she wants me to do just for her to like fill out 3 lines of paperwork. And that means that I'm not getting that access. I don't have the capacity to do that and to make more appointments and chase it down when it's right there. So like educating yourself, if you're a health professional, educate, um, learn and educate your colleagues about how to complete gender affirming paperwork. Like there in Ontario, we have to have the paperwork completed and approved by OHIP before we can even meet with a doctor. So getting that information completed and done and like learning how to do that is very helpful, and recognizing that like it's not just one barrier of being queer, it's access barriers as well, and so many, and poverty as well. Like um, all of these things compound, and it makes the access so much harder. Um, and that like that goes not just medical settings, but every setting. If you're always having to remind everyone of your access needs and your pronouns and your actual name and like all of these things, it's too much. And there's always amount of you, like, there's always a question in my head of like, how disabled am I allowed to be in this moment? How queer am I allowed to be in this moment? How much do I have to hide? Um, is it asking for too much? Like if I've already had to like say, okay, well, I need a lower chair, I need to this and this, and then I get misgendered. Now it's like, okay, well, I'm too much of a problem. I can't now just additionally correct them by like it becomes so much more stressful. And yeah, end thought.
Thank you for that. It does really speak, both of your comments speak a lot to um, providers, whether they be healthcare providers or social service providers, taking we hear a lot about this like a DEI approach, or in our project we call it JEDI, JEDDI, and that is justice, equity, diversity, decolonization, and inclusion. That if these providers could just take this to heart and follow that kind of philosophy, it would make for a far more inclusive service. And it does take some self-education, it really does, especially from a community such as the 2SLGBTQ plus communities that have not always been included. And so the public doesn't necessarily have the knowledge of internally how people function and operate, whether it's pronouns, whether it's their gender identity, whether it's their sexual orientation.
I think you answered the second question. Actually, all of you have. I'm just going to pass the question on, and if Matt wants to add anything, feel free, or anybody on the panel. The question is, given the unique challenges faced by the 2SLGBTQ plus people with disabilities living in poverty, what solutions do you see as most effective for advancing both economic security and social inclusion in Canada? Is it community or is it policy? Some thoughts?
So I have unmuted really quickly again. I do apologize. Although I think it's community based. Community's been leading the way in for community members. Like Sunshine House is my chosen family. The projects I'm with are my chosen family. I don't have family members. When I came out as trans, like they dropped. Like they were gone. Like you have to create your own family. And as an adoptive person, I've really learned the importance of chosen family because, yeah, our queer community, I definitely think it's community based, but government official needs to catch up with us and listen to the voices because it will smooth out things so much easier. We saw it during the pandemic actually with that $2,000 CERB. So while people were falling further into poverty, I was lucky enough by a freaking 2 weeks where I got CERB and my life was changed for the better. My social economic like blossomed. I mean, I had to make sure I lost my disability overnight, but the income coming in was kind of making up for that. But it just showed that with a universal basic income of some form, it really works. And in 1997, the Dolphin Project, we started that here in Manitoba, and the community was making it work until the government pulled it. So we have proof this stuff works. We've proven during the pandemic it worked. Like we were able to pull it out of nowhere, and now all of a sudden I have to readjust my life back to like below the poverty line where I just got comfortable. Like it was really nice affording adequate health. I mean, my mental health improved, my social determinants improved. I was isolated, but someone who lives low income in poverty, you're isolated as it is. We're built for this. But yeah, I really think community is the lead way to this, and the government officials need to listen to us as a community. But yeah, I'll let others go for it.
I'll jump in and echo Luca of community. Yes. Um, as someone, well, I think that like policy has caused so much harm already. It's continuously weaponized against us. In St. Catharines, the city is trying to make all the shelters here require sobriety, and that's gonna kill a whole bunch of us. Um, it's it already has resulted in death from other shelters closing down, and refusing to allow space in, and then accessing like policy defines what disability is, and anyone can be assigned a disability. And the queer community, we are inherently disabled according to the medical model and historical view of queerness. It makes us disabled already. And I I very much support community-led or community spaces, and communities need to get intersectional and need to get working with each other instead of, only like there's the largest Pride Niagara is the largest queer organization here, and they get a lot of funding. They get a majority of the funding from the city and the region, but they don't have a single accessible event. They don't make them accessible. Um, and like when they do, it's very limited. They consider accessibility just is the door wheelchair accessible, and they don't even define what type of chair could get through that door. Um, and so that means like half the queer, like all the queer community doesn't disabled queer community doesn't have places to go. Um, and so while the answer is community, the community has a lot of like in a lot of spaces needs to really um, get intersectional, I guess. That's my feelings.
Thank you, Dani, for that reflection, and Luca as well. I know we're running over time, but Nick, I wanted to ask final remarks on how can our viewers today get involved?
So I've just put up a slide on that features our contact information. They're welcome to visit our website. There's a Get Involved page there. We have a presence on social media platforms such as Facebook, YouTube, and Instagram. And our email address is there on this slide as well. And people are welcome to be in touch if they want to learn more about our work going forward and possibly be directly involved.
Thank you for sharing that. To our viewers, please feel free to reach out to also research at Disability Without Poverty. We'd be very happy to also forward any information on to you. Um, I'd like to conclude here at this point and just say thank you, a heartfelt thank you to this panel, Nick, Luca, Dani, Mike, and our well wishes to Celeste. I hope that was okay for your valuable perspectives. To our viewers, we're going to take a 10-minute break and we'll see you in the next conversation. Thank you so much.
Thank you.